Hello, I'm Dr. Wes Barry. I'd like to talk to you a little bit today about breast diseases or breast problems. They come in two forms, of course, the benign diseases of the breast and the malignant diseases. The benign ones, the most common being fibrocystic breast, very much so, do very little but cause concern over whether or not there's a malignancy present. Fibrocystic disease causes pain and discomfort in the breast that may or may not be cyclical in nature. Most breast cancerous lumps cause no pain whatsoever. It is a painless lump. Fibrocystic disease is important only from the standpoint of the symptomatology that it presents, and also to make sure that the lumps and bumps that occur with fibrocystic disease are not associated with anything more serious. Other benign conditions include various infections of the breast and various discharges from the nipples. The malignant, of course, conditions of the breast are that of invasive carcinoma of the breast, invasive ductal carcinoma. The second most common thing we see is ductal carcinoma in situ. The invasive ductal occurs in about 70% of cases, and it includes the tissue outside of the actual duct tissue, but into the actual matrix of the breast tissue itself. The ductal carcinoma in situ occurs within the ductal system. This is a microscopic tumor that spreads along the ductules. We should be able to cure ductal carcinoma in situ close to 100% of the time. Invasive ductal carcinoma has a cure rate upwards of 90%, especially when caught very early. The treatment for these diseases are very similar, and I'll explain them now. There are several options that are more than acceptable in breast cancer and in benign breast disease. In benign breast disease, a simple imaging study, which is usually a mammogram or ultrasound, followed by a fine needle core biopsy, can be taken to let us know if this is a condition that we need to treat further. In malignancies or suspected malignancies, we're able to do more advanced imaging studies such as MRIs and BSGIs to let us know not only if you actually have a breast cancer, but how extensive it is within that breast. The extension of it within that breast also gives us the options of whether or not we're able to do so-called lumpectomies versus mastectomies. Let me explain that further. Up until the early 90s, the gold standard and treatment of choice for breast cancer was the modified mastectomy. That's no longer true. Nowadays, we can treat breast cancer successfully with much lesser measures. We're able to do a lumpectomy, and instead of removing the lymph nodes under the arm, we simply sample them by way of what we call a sentinel node biopsy. The sentinel node is just the first lymph node under the axilla. If it is positive for any microscopic breast cancer, then we remove the lymph nodes under that axilla. If it is negative, then we do not. We couple that then with either a wide excision of the carcinoma itself or with a simple mastectomy. When we do the mastectomy, it is possible for the patient to have an immediate reconstruction by a plastic surgeon, or it is her choice not to have, and to have this done in a delayed manner or not at all. If you choose not to have reconstruction, a breast prosthesis is provided for you to wear comfortably with your clothing. If lumpectomy is chosen along with sentinel node biopsy, then of course the treatment of choice is to proceed with radiation for a period of 6 weeks. This gives us the cure rate that's equal to the mastectomy. Of course, if a mastectomy is done, then there's no need for the radiation. The choice of whether or not to have chemo after surgery depends on the grade of the tumor and other tumor markers, which we will discuss at a later time. Thank you so much for coming in and allowing me to see you for this problem, and I hope that I can help you and your family.